Just when you think hope is lost and giving up is all you got, and blue turns black, your confidence is cracked, there seems no turning back from here.
I met Mike one September night when I was assigned to him in North ICU. He was in his mid-20s with a history of leukemia, which he has been battling with for the past 10 years. I vividly recall Mike's carefree attitude. He was a pleasant and attractive young man, always smiling and surrounded by family members. Mike enjoyed telling stories, especially about his dreams and his passion for life. I initially took care of him as he was recovering from his bone marrow transplant. For a couple of days, he was doing well and progressing to be discharged from North ICU. I didn't hear about him for a few months, and one night after working 3 12-hour shifts, I was assigned to him once again. His recent admission to the unit 2 days ago was for full-blown sepsis. On this night, the charge nurse decides that Mike should be assigned to me as I have history taking care of him before. As I was receiving report during the change of shift, I looked inside the glass mirror at him and did not recognize the vibrant and happy young man that I had previously worked with. The room was also filled with family, looking equally exhausted and drained. As I was preparing myself for a mentally and emotionally rough night, I heard the previous shift mention, "He is now DNR and he may pass away on your shift." I became paralyzed and apprehensive as I have connected quite a bit with him and his family during the past few months. I summoned the courage to enter the room quietly and sadly and say hi to everyone. It's hard not to question at that moment, what could we have done? Could we have done more for him? Inside I was yelling, why? He's so young and had so much life in him. How is it that this is the end? As the night wore on, it was so hard not to feel useless. He was my only patient for the night. There were no labs to be drawn, no medications to be given, no orders to fulfill, just to provide comfort. Around 2 a.m., Mike's blood pressure started dropping to 60s over 40s. He was no longer responsive, and I started to notice Cheyne-Stokes breathing. The family was now quiet, occasionally dozing off, taking turns sitting next to Mike, and sometimes walking out to take a break. I went inside the room to assess Mike and overheard a conversation about funny things Mike would do. I thought this would be a good time to ask the family, what other good things can you share with me about Mike? Almost immediately, random stories of pranks, unique hobbies, and bucket lists came flooding in from every corner of the room. Finally, his brother looked at me and said, my favorite thing about him was his talent for music. He was an aspiring musician, you know. He has even written his own music. I will play one for you now. He pushed play on the CD player, and as the music played, we all smiled. It was Mike playing beautifully on an acoustic guitar, singing a melody about not giving up, but deciding to move on. As we all listened to the words, it had a calming but overwhelming message of goodbye and hope. My chest swelled up quickly as Mike sang his goodbyes to all his loved ones. Tears soon rolled out of our eyes and sobbing followed. The night dragged on and on. Mike's vital signs continued to drop, and it became a waiting game of when he would finally pass. The mother kept asking, do you know how long? How much longer? I embraced her and gave her a moment to cry out. Then I quietly mentioned to her, in my experience with hospice and previous patients, patients are not comfortable letting go until they are not alone. So Mother asked family members to say their goodbyes and step out for some air. I then found myself alone in the room with Mike. I proceeded to stand next to him and hold his hand and whispered in his ear, everyone is left, and it is okay to let go now if you are ready. I waited a few minutes and went over the computer to update my charting. After about 10 minutes, his respirations dropped to 4 per minute. and oxygenation saturation became undetectable. He was bradycardic in the 30s, and finally, I took a couple of minutes to thank God to have the opportunity to have met someone like Mike and his family. I then called the resident on duty to confirm his passing and notified social work and chaplain as well. A few minutes later, the family strolled back into the unit, and Mom reached out to me and gave me a tight hug and said, "Thank you for helping us through this experience." It was so hard to feel gratified at that moment, but I replied with, "It was an honor getting to know and care for him. Thank you for sharing him with me." What I did was not at all extraordinary. Nurses do it all the time. However, in retrospect, that experience taught me that in times when I may feel insignificant as a nurse, someone values the little things as your presence in a hard situation as just what they needed.
Oh